Well, we don't have a ton of time, so I would say we should just get started, and then as people join, they can jump into the conversation. It's the kind of conversation that we wanted to have everyone as a panelist because everyone has experiences with this, and everyone has something to add to the conversation. So several years ago, we've been having panels on and off on similar topics at MPA, where we bring in alumni from community psychology doctoral programs to talk about their experiences in landing jobs, changing jobs, getting promotions, applying what their training has been towards the field and towards paid work. And so a couple of years ago, Olya Glansman and myself edited a volume on careers in community psychology to try to help answer that question for prospective students and to give something to faculty to look at. So folks have a sense of, what are the range of professions that people get into and the roles and the jobs and the organization that they work with and work for with a degree in community psychology. So we tried to grab a panel today that would represent some of that diversity, but it's impossible because there's just such a wide range of work that folks are doing. So I think, everyone's familiar with the fact that, you can be a faculty member with a degree in community psych, but then the question becomes what else? And, people probably have heard about, well, you could do program evaluation, you could do consulting, you might do public health work, you might do education work, you can work in nonprofit, you can work for government, but it's really, really broad. And so just wanted to offer people the opportunity to hear about different experiences and then share their own, and so that we can help each other and help future folks who are students or folks who are wanting to change careers or kind of figure out how to best frame the skill set that they have to enable them to work effectively in the field. So with that, I think I will pass it over to maybe Jackie as our first panelist, just to talk a little bit about your career trajectory and how you're applying community psych to your work or have, over your career, and then, how you frame the skills or competencies of community psych in doing that work.
Well, good afternoon, everyone. So right now I am the program director of public administration, a master of public administration at National Louis. And I worked a lot as a consultant, actually, when I started out. I also have an arts background. So I've worked in communities, and some of the communities that I've worked in have afforded me the opportunity to work in different fields. I've done violence prevention, community development, economic development. I've also been a teaching artist, and I have found that the skills that I have that I actually use is my ability to help communities in terms of planning, evaluation, and I also like to work as a consultant with communities, especially today, because I see so many communities that don't have the resources to have a full range staff that they need. And so I usually come in and help them. Right now I'm working in the south suburbs, Harvey, Fort Heights, and Robbins, and I'm bringing in colleagues to come and help me with these communities as they're currently putting together a quality of life plan to reduce violence in their communities. So I find it's a full range of things that I do, and ironically, I do run into community psychologists in some of the practices that I have worked in, especially in violence prevention. And I'll stop right there.
Thanks, Jackie. So when you're presenting yourself to different organizations, to whether you're consulting with them or just being kind of an active, engaged citizen, how do you describe kind of who you are and what what you bring to the table, and do you use that title, community psychologist?
I do, and I have been doing that currently, especially working in the South suburban area. And I do let people know that I have, backgrounds pertaining to whatever it is I'm working on, because I am an artist too. So I do work with arts communities and do a lot of arts placemaking. But I usually tell them I'm a community psychologist. I let them know, and they look surprised and wonder, what is that? And I explain it to them. And then we realize that we do have a lot in common in terms of what we're working on.
Thanks, Jackie. Well, why don't I pass it over to Eileen Johnson?
Hi, everyone. I'm Eileen Johnson, and I manage patient relations and interpretive services for Northwestern Memorial Hospital and our clinics and our immediate care centers in Chicago. And being a community psychologist, I've been in healthcare for about 20 years, and this has been a great way to use my PhD in community psychology. In fact, with COVID, I just worked on a community health assessment with Northwestern. And so we've been working on finding those populations with underlying social needs for access to COVID testing, fear about food, how do we work with those populations, fear about coming in because they don't have any health benefits and they might have COVID, or they might feel that someone in their family has it, to get them mental health resources that they need, including emergency housing if they're in a really close-knit home or there's abuse in the home. And then I also worked on a lot of health education. So we have a lot of things that we've been putting into place at Northwestern, and so I've been a part of that, making sure that some of our populations that are underserved in our community get what they need and that they don't have to have fear around COVID, and understanding what it is and how can we help them get the health care that they need. So that was, one big thing where my community psychology degree had a direct effect on the community as well as in my work.
Thanks, Eileen. I'm scanning to see if our other panelists are here. We had Chanel Phillips, who is just finishing up a fellowship at the Center for Disease Control and Prevention in their adolescent health and prevention wing. And hopefully she'll be able to jump on and tell you a little bit about her work. She also has worked at UIC in the past, and will be moving back to Chicago to do more consulting and community-based work with her skills. And then Tonya Roberson, who actually just transitioned from University of Chicago to a position at Governor State University, where she's the new Director of Community Engagement, Program Development, and Academic Support. And she's also an adjunct faculty in the College of Health and Human Services at Governor State. So until they join us, I want to just see if there's any questions. Feel free to enter questions into the chat. I can talk a little bit more about my experience and then pass it off to the panelists who are here. But really, we meant for this to be an interactive discussion. So any questions you have about careers and how to position yourself as a community psychologist, that's really what we wanted to dedicate this time to today. So as I mentioned before, there really are lots of different practice options for folks. And so, one of the things to be thinking about if you're a student is, how to position yourself and what type of experiences are going to be most helpful for you in doing that work. And it looks like Chanel has just joined us. So I will allow her to introduce herself, and what we've had each of the panelists do is just explain kind of the role that you're in now and how you apply community psychology to that work and how you frame your skills as a community psychologist to folks that you come in contact with. So Chanel, are you able to unmute?
I've just promoted her to panelist. It's gonna
Ah, okay. Thanks, Jean.
get back in again.
There you are. Hey, Chanel.
Hi guys, I'm literally in the car. I was turning around and say hi, Brandon. Okay, now my position. I hope everyone's doing well. Currently, my position. I'm here in Atlanta. That's why I was turned around with the time. Working in a program evaluation capacity with the fellowship for the division of lesson and a school health. So I work in the research application and program evaluation branch. This is my second year. I'm scheduled to graduate or wrap up in August. It's been an interesting position because public health isn't my targeted space, but it has benefited me the opportunity to the language, if you will, of public health, and to see how the federal government partners with communities via funding. And so I've learned a lot in the program evaluation fellowship. The way that I use community psych coming into the space is to remind leadership and the staff, which are primarily epidemiologists, that the community are the experts on their own lives, and to also remind them to try to take a bottom up as opposed to a top down approach, and keep the lines of communication open with working in the community. And so I also, in regards to research, advocate a great deal on the benefits of using mixed methods, because I've learned in the federal government, they really rely heavily on using quantitative research as their go-to for interventions. And so that's pretty much what I'm doing right now.
Thanks, Chanel, and welcome.
Thank you.
So this is really for any of the panelists to jump in, or anyone else. I see a lot of familiar faces on the group here, and I know that everyone could contribute equally. But what have been some of the greatest challenges for you all in your role, given your background as community psychologists? And then what have you done to overcome those challenges, either to land the position you're in or to be successful or effective in the position that you're in?
I'll start off. I was thinking about a lot of time I've been doing some consulting in communities, and I think the hardest part is when the program ends, and I have built all of these wonderful relationships with community, and they look at me and go, "You're coming back, aren't you?" and sometimes that becomes very difficult. So I try to really stay engaged no matter what with the communities that I'm working with. That usually is my biggest challenge, is being able to stay there and support those communities, and help them as much as I can.
Eileen, do you want to jump in?
Yeah, I think one of my biggest challenges has been to keep reminding those in senior leadership always, right? Like, we are connected to the community, and we need to continue to put those feelers out and have those groups, and continue to talk about how do we engage those groups to drive us. One thing that's been really great is having this patient family experience team that comes in. It's families from all over the city. every SES, every background that you could imagine, and then talk to them about what their needs are and why. And then how do we incorporate programs and resources to make sure that those needs are met. So, you know, we continue as a group to hear, but I'm not sure if we give the best platforms for them to hear. So, you know, one of the things is, oh, well, come to the hospital and, you know, we're going to have this meeting on Thursday nights. Well, what about those folks that don't have transportation or don't have the dollars to get there? Or, you know, how do we engage people and patients and families that can participate? You know, and we need to think about that. And as a community psychologist, just continuing to peel back the onion and educate these leaders, you know, who really want to set these great programs in place, but they are at a little bit of loss because they don't have that educational component. That's where I think our voices really need to be heard in a real gentle way. How do we steer them to make sure that everyone in the community has a platform? And that's the most important thing in healthcare, because everybody has different needs, but how do we make that happen? Set up those programs where they can benefit from it.
Great, thank you. Chanel, feel free to jump in. Otherwise, I'll go on to another question.
Yeah, my not so much struggle, but probably irritation or confirmation for me that public health is not my space is really encouraging leadership and staff to become more culturally competent and responsive. It's just something that's not a part in federal government, and you know, just constantly reminding them to ask people what it is that they need, you know, as opposed to prescribing, you know, the solution. Again, that whole top-down decision making. Why you have to tease or struggle to get success stories. If you would ask, you would be so shocked that you're doing it, an intervention, and you know it's not working the way you intended it to work.
Can I say I agree in, you know, working with in government agencies becomes very difficult in navigating that and looking, you know, out for the public value it becomes really difficult in fighting for them. So I tend to find it better for me to work as a consultant with the government agency so that I can be a little bit more of that go-between and provide a little bit more support systems for the communities that are getting the services.
Great. So now I want to move on to hearing guidance and advice. And I think it's advice both for folks who are on here that are faculty. So, you know, for the faculty, what advice do you all have in terms of, you know, how we ought to be supporting students in order to launch their careers when they leave and sort of leave on a good foot and be well prepared and well positioned for success, and or guidance for folks who are students or maybe who are want to change careers or change roles and change the using their community psychology values and experience. So guidance and advice for those who want to make the change or want to prepare themselves or want to do this work as community psychologists, and or guidance for those who are in positions of faculty.
Well, my go-to strategy is networking and professional development. Just like, for instance, going to conferences like this, you always meet somebody that you might find a commonality with, and you might continue to, you know, stay in touch with them. I belong to a lot of boards, advisories that fulfill the platforms that I find important to me. Such as trauma-informed care. I sit on some networks with that. I sit on community advisories with Trinity Hospital, UIC, and I get a chance to meet a lot of different people. And you might not need their help right then and there, but you never know when you might run back into them. And the other thing I do when I'm looking at for jobs, I tend to, if it's a agency I'm really interested in, I always go to look to see who's on the board and or who's on their advisories and see if there's someone on there that I might know to find out a little bit more about the culture of the people. And I find that to be very helpful.
I would pick up on something that Jackie's just saying about networking. To begin with, in addition to expanding on your own networks, it's good to just reach out to faculty to ask about their network, because very often we can make connections between students and individuals that we know in our networks. And the other one is within cohorts or groups of students. A lot of times we see at National Louis that students will bring opportunities to each other. And it's about letting even your fellow students know that you're interested in expanding, and those are good resources as well.
Judy, what others think? Anyone, it doesn't have to be a panelist. Feel free to jump in and add your wisdom to the group.
It's okay, I'll jump in. This is Susan, and I'm at Roosevelt University, and I'm the director of a clinical program. It's not even a community psych program, but I do teach community psych courses. And there's a lot of points of convergence, and I have worked with students, both steering them into the beautiful program at National Louis and DePaul and other programs too, that there were more less further along in their careers, and they finished out like a PhD, as a community psychologist. But then I'm more in the position of trying to get community psychology into our university. And I think one of the challenges for us who want to kind of help people into these community psych careers is the fact that community psychology, like no one is looking for community psychology. There are no job ads, very few that say we want someone who's a community psychologist. And so I think that, one thing that we as faculty members can do is just to kind of help strategize around that. I do have some clinical folks, who graduate, and I try to give them some skill sets, and I see them afterwards, doing all this wonderful stuff. They don't call themselves a community psychologist. Well, sometimes they do actually, which I think is great. But they'll do things like evaluation, program evaluation, and working with different community organizations and so on. So, and I see my role as trying to help them see, like, this is where some community psychology could be happening. And your skill set could be used in the service of this community psychology, even though this employer is not going to call it community psychology. And then more recently, as you all are talking, I was thinking how we had like a job ad, and my colleagues put together, like, we have these needs in the department, and I thought this is perfect for a community psychologist, and but that's nowhere in the job ad, and so I've been put on a listserv, talk to people. We've got applications for community psychologists, and in some ways it's such a perfect fit in terms of what the description of the job is, and both in terms of social justice and just different like skill sets. And so I see myself as trying to kind of fit people into those needs, and also at the same time saying, well, telling people like, oh, I'm a community psychologist and this is what I'm about, and people seem interested and willing to engage, and I've been very happy to do that actually with the current job search, for at Roosevelt, that I've been telling my colleagues about community psychology, and this is what they do, and this is why they'd be a great fit, and my colleagues have been so, like, they've said, wow, that's great. So I'm really excited. Hopefully we'll hire a community psychologist soon. But I think that kind of,
Susan, maybe somebody on this meeting would apply for it.
yeah, I will keep sending those out too. So yeah, but
so is it a faculty position or a different role at the university?
It's a faculty position. It's actually a non-tenure track position, which is not so great, but it's titled professional practice, which of course you all know. That can include a lot of wonderful community practice. So yeah, if you're interested, our job is up through Roosevelt. but yeah, I mean, I think some of it as a faculty member, you know, to get back to the question, you know, as a faculty member, I think that's kind of some of my role. I'm trying to help fit people and help people network or ask that person for a job, as other people have said, just to kind of facilitate those connections. So.
Thanks, Susan. Who else wants to jump in?
Oya had her hand raised.
Yeah,
Oh,
thank
go
you,
ahead,
Pam.
Olya.
Thank
Hey,
you so
Olya.
much.
Nice to see you.
So I'm trying to remember, there are so many wonderful things that we've learned from the book when we were working on that project. And one of the things that our participants in the book, the contributors, said was that it was much easier to get a job in a place where there was already a community psychologist, because then everybody knew the type of skill sets they have and the type of values that drive them. And so I just want to encourage everybody, wherever you are, do let everybody, including your employers and colleagues, know that you are a community psychologist. So the next time when somebody comes in, whether it's in your organization or somewhere else, and says, I'm a community psychologist, they do get that positive association with either the project that we're on working with you, or if they had an employee or a boss who is a community psychologist.
I can't raise my hand, but so I'm just interrupting to say that a great resource is the SAA Job Board. Every job announcement that comes across the Listserv is put up on the job board. We regularly send out notices about it that people should check it. But and a lot of those types of jobs that people say, I know this doesn't say community psychologist, but it would be a great fit for one. They're on the job board, and postdocs and all kinds of different things. And there's been a lot coming out lately, a lot of job announcements coming out lately.
So I would encourage students to also be open to creating a diverse learning experience. I know a lot of times you go into, you know, your training program and you have an idea of exactly what you think you want to do, but be open to going outside of the box, whether it's exploring a different topic area. If you are very practitioner oriented, maybe learning, hey, how could you be in an academic environment? Because you never know, the trajectory of your career may cause you to be in multiple environments simultaneously, or just you may be in one at one period and then the other at the other period. So if you allow yourself to have a training that allows you to be able to pivot, that will increase the success of you being able to find a position that fits your skills, your assets, and that will be embracing of a community psychologist.
Thanks, Amber. Thanks, Jean. Thanks, Susan. Anyone else have ideas or suggestions they want to share?
Good question.
Oh, go for it. A question from Jack.
Hi. So something that drew me to, I'm a DePaul student, something that drew me to community psychology was it seems to lend itself to a lot of other fields like sociology, education, policy, law, all of this stuff. So to the panelists, did you have a clear idea of where you sort of wanted your careers to go, or did you sort of just let, you know, go with the flow? Like what was that experience like for you? Because from where I am right now as a rising senior, I'm sort of like, wow, I want to do everything. Like, how will I have time to do everything I want to do? So what was that experience sort of like for you?
Great question.
Thank you.
I'll start. I did not think I would end up in academia. My plan was to get some research experience after I finished my degree, so I stayed on at DePaul as a researcher in their institutional planning office to learn how to do more quantitative work with larger data sets. And at the same time, I was building up a consulting practice doing mostly program evaluation work with local nonprofits, small and mid-sized nonprofits in Chicago. And started to do networking, as Jackie said, and through the American Evaluation Association and the Chicagoland Association, got involved with them and landed several projects, and that was great. And I was starting to think about, after a couple years, going out on my own as a full-time consultant. But at the same time, that network, what it led me to was finding out about a faculty position at National Louis to help with a newly developed community psychology doctoral program for, you know, non-traditional students. And it seemed like too good of an offer to let just go by without considering. So that's what ended up landing me in academia. But I'm sure others have, you know, various perspectives. Eileen, I assume you knew what you wanted to do with it, but I'll let you talk, and then we can check with the other panelists.
Yeah, you know, I never dreamed I'd be a community psychologist, actually. I was in healthcare, and I didn't like how it looked. Like, that was the start of the whole thing. You know, people that have insurance and people that don't. And those types of things really started to bother me. And I really started to feel, what can I do about it? And I just kept staying at NLU. I was 10 years at NLU, bachelor's, master's, and my PhD. I just think that it really offered what I needed. And as I kept staying in healthcare, I kept thinking, what am I doing? Well, I'm in the community and I work a lot with healthcare and people that need help, and it's psychology. So it kind of just, it was very organic how it just evolved. But I think there's a very strong tie, especially now, with community psychology and healthcare or public health and things of that nature. I just keep seeing this huge overlap of a lot of careers. But it just worked for me with healthcare, and I always wanted to stay in healthcare. It wasn't going into consulting or academia, really. I just wanted to continue on this track of healthcare, but where could I put, you know, my emotions to drive every community getting healthcare into practice? So that's why I stayed there.
Interesting, thank you.
For me, I actually stumbled into community psych, and I had Lori Parkinson, if she's on the call, to personally thank, because she actually asked me about community psych, and I didn't know what it was. I literally told her, oh, I'm not interested in telling people how crazy they are, right? Because I'm completing my master's in public policy at NLU, and when she talked about system empowerment and system community, and it being action-oriented, participatory action research, I'm like, oh, I've been doing that my whole life. They actually have, you know, something for that. And it's like, yeah. And so that's literally how I was introduced to community psych, because for me, it was the perfect connection with public policy, right? Policy being the end result of being able to see the change, but community psych working from the very beginning. And so I'm one of the people that believes that you don't find community psych, it actually finds you.
It's funny you say that, because that's how I felt when I was at DePaul, and I was like, oh, that's what I've been wanting to do the whole time. Found it. Like, thank you for sharing.
You're welcome.
Chanel, you know, my gosh, I feel the same way. It does find you. I was also in the public policy program at NLU, and I remember I've worked in communities for like over 30 years, and the professor I had at the time, he said, you know, you might want to check out the community psychology program. They just started, and you know, I'll be honest, you know, when I got my bachelor's degree, I never thought I'd ever go back to school. I was done, you know, and then I was in this position where I was working so heavily with community and elected officials. And I said, you know, I think I need to kind of tool up a little bit, you know, and stop working so much from instinct. And I did, and that's when I found out about it. And I have to say, when I was in the program, it fed my spirit so well. It fed my spirit. I could identify, and I felt tooled up. I felt like I had a broader knowledge of what I was doing, and it was more tangible what I was doing, and I knew how to go in a better direction rather than just being an instinct. I knew the theories, I knew how to do it in practice, and I knew how to integrate it together. So I've just always been grateful I found it.
Great, thanks, Jackie.
Thank you.
If there's other questions, feel free to jump in while oh, Tonya, did you want to say something?
Yes, I just wanted to make sure everyone, hello everyone, just to make sure that everyone is familiar with Chronicles of Higher Education jobs. They have jobs just pretty much in psychology, but it could be some jobs in community psychology as well, and then higher ed jobs. I like higher ed jobs, not so much, I haven't seen any jobs that, I'm also interested in, but they have really good articles to strengthen you as you're looking to obtain that job. I think they're really good at that. So I would suggest that you follow those two sites for jobs. And the last thing is, well, I guess two more, is definitely the research. Build your curriculum vita as far as being involved in research. I really personally think that makes you a stronger candidate. And last, I would say talk with one another. Sometimes it's pretty tough not to find a lot of jobs that are out there that you're interested in. So have someone, a colleague that you can share with and talk to and get feedback from, and maybe this person has experienced something very similar to what you're going through, and that can make it easier to sort of hang in there and get that dream job that you want.
Thanks, Tonya.
Thank you, Judah.
Go ahead, Olya.
I wanted to add something too. So I know we've talked about networking a lot. That's so important. But also when you're working, you are working on lots of different projects. And when you're submitting for a conference, many times you're submitting with kind of your research group. Do collaborative work, reach out to others. The more people you know, the more they know you. This is also creating connections because a lot of the people, again, will keep you in mind if there is a job that they think fits well, especially if you're in similar areas of research or interest.
So I also want to point to the chat. I know that Chanel talked about the value of fellowships, and that can be another way to find out what you do want to do, what you don't want to do, as she was saying in her case. And then also going back to what Susan mentioned earlier is that, since there are not so many positions that specifically post and request a community psychologist, particularly I recall from the interviews and surveys that Olya and I did with professionals in the field, asking them how they landed their positions and how they framed the work that they do when they were applying to a position that wasn't asking for a community psychologist. They really emphasized the competencies, so the specific skills that they had gained in their training, as well as the values that they bring to the work. So they talked about their research skills, they talked about their facility with data analysis, they talked about their value of diversity, they talked about their ability to facilitate dialogue and build community and collaborate and partner with others, and all of the things that we read about and learn about and focus on as we are doing our training in community psychology. So focusing on the experiences you've had, the skills that you have, the values that you have are the things that can help differentiate you in any, really in almost any field. What other questions or comments do folks have that they want to add?
I had a question. Positions are posted, let's say, at Northwestern, and I think, gosh, that would be, great for a fellow community psychologist to come in. Is there a general place that you feel would be better to post some jobs or to give folks a heads up? That's something that just came to my mind because there are a lot of leadership positions that I think would really benefit to have a community psychologist. I just never thought about where, I could post them where the majority of folks that have our same interests would see that.
Certainly, as Jean mentioned, the job board on the Society for Community and Research and Action website, as well as the SCRAW Listserv would be two great places to start. But if others have other suggestions, feel free.
Great. Thank you very much. That's helpful. Thank you.
I'd like to say it's okay to not fit when it comes to current job descriptions and current opportunities. I think that it's okay to create what you want. Yes, it's a little bit longer in terms of funding and having to be a little bit creative, but don't feel as though you have to fit if you don't fit. You just have to be more creative about creating what you want.
I think that's a great segue, Amber, into talking a little bit about how you've created your role and what position you left and kind of how you built it.
So one thing I realized a couple of years ago was that I didn't fit into the existing nonprofit structure. And so what I realized was that it just lacked sort of what I believed in and how community work should be done. And I also learned about myself is that I like to do different things. And so I've sort of created what I like to call a bouquet of flowers when it comes to how I think about my career. So I enjoy teaching. So I'm also an adjunct for NLU. And I enjoy connecting the things that I've been doing in the community to the coursework and to the students and engaging them and hopefully inspiring them to pursue their passions. But I also have created my own nonprofit organization that focuses on engaging with communities utilizing innovative strategies and pivoting when it's necessary. A lot of times the nonprofit structure, they stay within a particular program even if it's not effective. And so that was not the sort of structure that I wanted to have. And I wanted to create something that was truly driven by community voice, from having community engaged research funding that has been a partnership with communities, from hosting various events that have been in person primarily, and this is the first one virtually, to get people to engage in various different ways. And so I'm an advocate for just trying different things. And I also consult as well, not under my nonprofit, but under an LLC. And that allows me the flexibility, and I get to choose what projects I like to do and what I don't want to do. And I think that was something I realized that was really important to me, because I felt that I was in environments where my skill set was not being utilized to the extent that I felt it should be. And as opposed to just sticking around and just waiting for things to change and bureaucracy, I just said, you know what I want is out there. I just have to create it and own it. And be okay with that. It takes a little time, but when you find the space that you're supposed to be in, everything comes together and you're a lot happier.
Awesome. Thanks, Amber. And I know you've been able to land some grants doing that work, as well as partnerships with University of Cincinnati. So it sounds like it's happening for you. So we're thrilled about that. Anyone else have questions or advice for others that they want to share about doing the work, getting the jobs, making it happen?
Hi, everyone. To remind you that the next session is on a different link because we're switching to a meeting format so we can use breakout rooms. So I've just sent out that link for everyone.
Great. Thanks, Jean. One other thing that I've been really heartened by in the work that I've done, I just fortunately got done with a sabbatical, a one-quarter sabbatical, where I got to interview and meet with 34 of our graduates from our doctoral program to ask them about a variety of things, but one of which I was asking about their careers and how things were going and what they were doing and how they were contributing and engaging in the community. And it was wonderful to hear not just the variety of work and the wonderful impact that they're having in the community, but how they all felt like they're able to find positions. So that several of them jumped around and tried different things, in order to, find that perfect fit. And some are still planning to transition out of the roles that they're in currently. But there's no shortage of work. I mean, we know, given the state of affairs of our country and the challenges that we face in so many areas, education, healthcare, criminal justice, you name it, there are ways that we can improve and bring people together and learn from each other to do that work, collect data, tweak what we're doing. So there doesn't seem to be a shortage of work, and it's not just all volunteer work. People are able to make a career out of this in a variety of ways. And so I think that's heartening to know, even if community psychology is not yet a household term, folks with the skills and who want to be doing this work are able to do that, regardless of subspecialties or areas that they care deeply about. I see somebody else chatted to me, said that, another thing they would add is just the value of being open to new experiences, so that you can continue to grow your areas of strength and then leverage them into new positions and jobs. It's a great suggestion. Thanks, Katie. Well, we've got 5 minutes left. Who wants to give some more words of wisdom?
I would just say that things are all over the place right now with all of us and all our families and our nation. And this is when I feel we are needed the most. I think that we bring our values. When I think back to that class, when we had that list of our 7 values as a community psychologist and what we stand for and what we're trying to do every day, I think we're the group that not only has the tools, but I also think that we've done the research and we're really involved with communities for the betterment of our communities. And I think that, we are in high demand at this time. So I know that there's a lot of job loss. I've seen it all around us too, and people be laid off all over the place in healthcare and furloughed. But I must say that this is a time when our skill set is really needed. And so I'm just so grateful that I have this degree and experience and had the fellowship of going to class and learning those tools.
Thanks, Eileen. Appreciate it.
So I want to share a comment that was sent. And would it be possible to generate a larger network of all community psychologists? We do have the member directory, but a lot of people who have replied all on the Listserv are not on the directory. And so I wonder if that may be something maybe with membership versus not membership, as to why maybe we're not capturing all the community psychologists that are actively engaged.
That's a good question. That's a good question, Amber. I think it probably isn't, and Jean might be able to answer this better, but my hunch is that you don't have to be a SCRA member to be on the Listserv. And so there certainly might be people who are there, but maybe you do, or up until now, you've needed to be a SCRA member to be in the member directory. So maybe in addition to the member directory, we could have another type of directory that's even more inclusive.
Yeah, I would encourage everybody to maybe partner up with the Practice Council. That's one of the things that Practice Council has been working on, is trying to make sure that we don't lose practitioners so that they are not leaving or never learn about SCRA. And so that could be another resource, the Practice Council from the Society of Community Reach in Action.
Jude is correct that we do not require you to be SAA members to be on any of our listservs, but it would be impossible to put together a directory from those sources, because the names and the emails, we would have to email each person individually to say, who are you and do you mind being put in a directory? So It's
So maybe we could create some type of an opt-in directory through like a Google Doc or something along those lines. But I agree. I think with Olya, maybe we see if the practice council might be willing to take that on. Well, it's 3:49, and so I think, you know, unless somebody wants to close with something else, why don't we call it? Give folks 10 minutes to gear up for the next conversation, which I know will be a valuable one, a difficult one, but one that I'm certainly glad that we're having today.